Tonight at Mitosis News, we'll be talking about the widespread topic known as HIV and the use of ultrasound.
Welcome everybody, hope you're having a great weekend. We'd like to bring up the serious topic of HIV. My name is Kylie and tonight I will be your news reporter. We are joined today by Dr. Ruge, an expert on the HIV epidemic.
Hi everyone, I'm glad to be here.
HIV stands for Human Immunodeficiency Virus that has affected many individuals from around the world. Someone could be diagnosed with HIV and no symptoms could be shown for a long time. It can create the immunodeficiency syndrome. Tell us more about that, Dr. Ruge.
Well, it is a certain condition that can be obtained in humans that causes failure in the immune system by destroying cells and tissues that can get worse over time, which can become a life-threatening issue such as infections or possibly even cancer.
So Anita, when did you first find out you were diagnosed?
At first I never felt any symptoms, but as usual I went for my regular checkup and my doctor asked me to do a blood test. They tested HIV positive.
Do you by any chance know how you obtained this disease?
Doctors had told me how I was diagnosed, but at the moment my mind is not at focus.
Alright, let's ask Dr. Ruge, the expert on HIV.
Well, HIV can be found in many body fluids, including blood, semen, breast milk, and many more.
Michael, is it true that HIV can be transmitted worldwide through unprotected sex, sharing needles and syringes, unsterilized body piercings or tattoos, and blood transfusion?
Yes, that is true. The actual infection itself can be found in the blood cells of a human, the semen cells belonging to a man, the vaginal fluids belonging to a woman, and can be found in breast milk of a person with HIV. So if the bodily fluids of a patient were to come in contact of a person who doesn't have HIV, it'd only be a matter of time before the virus spreads to the cells in the immune system, which is responsible for fighting diseases. The virus would spread there and destroy cells in the immune system and begin to multiply there as well.
Let's go back to Bethany's report on Anita's conditions.
Anita, would you be willing to tell us about the type of treatment that you have been using to cope and fight HIV?
Well, the doctors told me that they still have not found a cure for HIV, but there are medications that can dramatically slow disease progression.
An example would be the Antrapla. It should be taken on an empty stomach once a day, daily, and only if recommended by a doctor, of course.
Anita, what are some of the symptoms you have experienced?
I experienced a high fever and swollen lymph nodes, which is one of the common signs of HIV. I also had a mild cough.
Other symptoms include fatigue, diarrhea, weight loss, and shortness of breath. HIV can also become AIDS when the virus destroys the CD4 cells, also known as T cells, in your body. A person infected with this disease will have AIDS when the person's CD4 count is less than 200 millimeters cubed.
All of this information is great. I have learned that HIV is not just something you can obtain from unprotected sex, that HIV infects the immune system of a patient by destroying cells there, that it can be transported through various bodily fluids by men and women, and that there is currently no cure for this epidemic, but there are treatments for slowing down the progression of this disease.
We'll be back after this short commercial break on our next segment on ultrasounds.
What's that smell?
God, is that you?
Yeah, what's that smell?
Well, it is the pink lemonade pound cake Bath & Body Works scented candle.
Mitosis at 6. This week, ultrasound. Ever since 1956, technologies such as the ultrasound have been used more commonly. Ultrasounds are also known as medical sonography. They are used to display the movement of parts of the body, for example, the heart. They are created by displaying high-frequency sound waves on a certain part of the body, most of the time from a microscope that is connected to a scientific computer. When we first think of ultrasounds, we automatically think of pregnancy and capturing a picture of the baby inside its mother's womb. However, this is not the ultrasound's only purpose. Ultrasounds can be used to view any soft tissues within the human body.
Here we have a young woman who has just undergone the ultrasound procedure.
Hi, I'm very glad to be here and I can't wait to share my experience with you all.
So would you like to start off by telling us a little bit about how the ultrasound session went?
Sure, they put on some gel on my stomach and then they placed the probe on top. I'm not sure why they put the gel though. Can you explain it to me?
The sound waves do not travel well through air, so doctors fill that air with the gel that they put on your stomach. This allows the final image result to be as accurate as possible.
Why can't you see bones in ultrasounds?
The sound waves produced by the machine go through solid tissue, but can view soft tissues, which is anything that isn't a bone.
Ultrasound is also the most commonly used technology for pregnancy checkups because it is painless. Unlike other techniques, ultrasound does not use ionizing radiation, which can cause pain. Anita, what did you have to do to prepare for the ultrasound?
I went for an obstetrical ultrasound, which is also called a prenatal. I had to drink 8 ounces of water 1 hour before my appointment, and I was not allowed to urinate.
Yep, sounds like an obstetrical ultrasound to me. However, there are many different types of ultrasounds, each with their own unique techniques designed for different purposes. For example, the renal ultrasound, which can only be performed on the kidney or bladder, requires the same preparation as the one Anita used. Some ultrasounds, such as the vascular ultrasound, do not require any additional preparations. Some have age requirements, such as the abdominal ultrasound, where children ages 3 or younger can drink and eat as usual.
The doctor told me that all ultrasounds use high-frequency sound waves to visualize organs within the body, and the sound waves are able to go through hard substances such as bones.
Well, Anita, although there is no pain for the type of ultrasound that you have received, what are the disadvantages of using this type of technology?
It was kind of uncomfortable, but it wasn't as bad as I thought it would be.
Some advantages?
It was a quick process. It may not cost a lot, and the results are quite satisfying. There's no painful aftermath, and so I can go home and continue with my daily life after I have some food and urinate, of course.
So what did you get through all of this?
Pictures of thin, flat sections of the baby was displayed on a computer, and the doctors were able to see how the baby inside my body was developing.
Also, water-soluble gel is placed on the skin because waves do not travel well through air. Any air in between the skin and the waves would cause a disturbance in the results. The gel is used to fill in any possible air pockets so that the waves may travel smoothly.
How much do ultrasounds cost to perform?
The cost, on average, could range from anywhere between $100 and $1,000. Factors that influence the cost include where you get it done, who does it, for example, what physician or other professional conducts it, taxes included, if it's 3D, 4D, or the classic, most common 2D option, if you have insurance, and the overall quality.
I don't think I was aware of some of the risks. What are some of the risks involved with the ultrasound procedures?
Dr. Ruge informed me that the procedure itself is practically risk-free.
Wow, I learned a lot today. I learned that there are many different types of ultrasounds, each with their own unique techniques. And there are certain things a patient must complete before undergoing an ultrasound. The costs vary depending on certain factors. A gel is commonly used to display soft tissues within the body, and ultrasounds can provide answers for the overall growth and development of babies and other organs within the human body.
Well, that wraps up Mitosis at 6. Join us tomorrow night at 7 for the premiere of Kylie, Chiu, the Science Girl.
Kylie, Chiu, the Science Girl. Kylie, the Science Girl. Kylie, 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 Kylie.